It's Sarah here from BJC Health, coming to you from Sydney, Australia. Thanks for showing an interest in one of our educational events. You're about to watch part one, so enjoy the event. If you've got any questions about the content, then please consider joining BJC Connect, where you can access all of our facilitators live. Otherwise, please consider leaving a comment and we'll do our best to get back to you.
All right, so I hope everyone can see my screen. So as Dr. Alana said, I'm a rheumatologist, but I spent a year in training in medical problems in pregnancy. So not just rheumatology problems, but other medical problems in pregnancy. I actually wanted to become an obstetrician and then decided that I didn't want to be awake in the middle of the night. So I thought rheumatology would allow me to look after women of childbearing age and see them through their entire lives. So that's how I came to be a rheumatologist. So in terms of what we're going to talk about, or actually acknowledgement of country. So I'm hosting the webinar from the country of the Wangal people. I recognise the traditional owners of the countries where you all work and live and the First Nations people present in the webinar today. So what are we going to cover? Well, firstly, I want to make it really clear that most pregnancies are safe and uneventful, but it's important to plan. So I'm going to talk through what we should be doing before pregnancy, during pregnancy, after delivery, talking about contraception so that we can plan pregnancy, and then go through any comments or questions. So before pregnancy, planning is the most important thing. So planning, making it a priority to talk to your GP and your rheumatologist. So before pregnancy, you must speak to the GP about your vaccine status. There's screening that you can do with you and your partner about whether you might be a carrier for any genes, making sure your dental health is up to date, but that's sort of general pregnancy things. You also should talk to your rheumatologist at least 6 months prior to trying to conceive, because it's really important to have your condition be controlled or quiet for 6 months on medications that are compatible with pregnancy, because it's uncontrolled active disease that increases risk for both the mums and babies. So planning is absolutely key. Having a team is really important. So rheumatologist, general practitioner, obstetrician, and other specialists as needed might be appropriate. But having a team around you that can communicate with one another is crucial. And so some questions that you might have for your rheumatologist when you're planning for pregnancy are my medications safe in pregnancy? And does my condition increase the risk of pregnancy complications for me or bub? So, you start to think about this before you consider pregnancy. So once again, is my condition active? So that's the question you could ask your rheumatologist, because you want it to try and be as controlled as possible. And there's specific conditions that can raise the risk of pregnancy complications. So, having active lupus, some things that can go with that, having uncontrolled blood pressure, being, over the recommended weight, having previous preeclampsia, they can raise the risk of some pregnancy complications. So trying to reduce those if we can. And there's some blood tests that your rheumatologist should do before you consider pregnancy. So medication safety is a big question, and often patients will worry about taking medications in pregnancy. I know myself when I was pregnant that I worried about medication, so it's completely natural. And sometimes the categories that medications belong to does not reflect the evidence that is currently available. So you may or may not know that all the drugs have different categories, A being completely safe and X being not safe at all in pregnancy. There's B, C, D as well. And so the Therapeutic Goods Administration comes up with, and the FDA, the American version, has drug categories. But those drug categories are not always accurate, because it has to do with the pharma companies funding research to be specific enough to show in randomized controlled trials that they're safe. So talk to your rheumatologist before just looking at the drug categories, because it may not be completely accurate. And always speak to your rheumatologist and general practitioner before you change your medication. Okay. So in terms of, this is sort of my traffic light, well, is a common way of looking at medication safety, but a traffic light system. So what's safe to continue? What should we use caution in? What do we definitely need to stop? And what don't we know? We know a little bit, but we could know more. So hydroxychloroquine, sulfasalazine, colchicine, azathioprine, tacrolimus, TNF inhibitors, and prednisone are all safe to continue. We have some caution around anti-inflammatories because, pre-conception, there's some thought that it may affect the ability for an embryo to implant, but and then in the final trimester, it can be a concern. So you cannot use it at all in the final trimester of pregnancy. So we use caution around it. And I generally tell patients not to use anti-inflammatories if they can avoid it. And then there's ones that we need to stop prior to conception. So methotrexate in particular and mycophenolate. And the others, we need more data. Okay. And a lot of medication safety is uncertain because data is mostly derived from case reports because women and babies are often excluded from randomized controlled trials. Due to concerns around safety. This is too wordy, but I just wanted to show you that this is the newest guideline for doctors from 2023 about use of medications in different trimesters. And you can see that, it's pretty clear about what they recommend. But there's also, not that much data. So they're provisional recommendations, and it's all about discussing with your treating doctor about how to continue. So other considerations like fertility, does my disease affect fertility? Will it make it more difficult to conceive? Well, actually fertility is usually normal. There's an exception for people that have been treated with cyclophosphamide before, but that's quite rare. And the main concern about fertility is age. So your people are most fertile, or women are most fertile from their late teens to late 20s. They say about, 1 in 4 people that are trying to get pregnant will fall pregnant easily, right? Whereas, as you get older into your late 30s, that really can decline. So it's age that is the biggest predictor of fertility. And really most rheumatic conditions, they don't change your fertility, most, okay? Some people might need assisted reproductive technologies, and it's important also to speak to your rheumatologist around that, because some of the assisted reproductive technologies, I'm talking about IVF, can increase different hormonal levels. And so you should speak to your rheumatologist before you go through that, and they can liaise with the fertility specialist. So general lifestyle factors, okay? So before pregnancy, you should absolutely stop smoking, okay? Smoking increases the risk of prematurity, underweight babies, lung problems, SIDS, and stillbirth. Do not take any recreational drugs, reduce alcohol consumption, maintain a healthy weight range, put in exercise prior to pregnancy, which is regular, because you shouldn't start new exercises in pregnancy, and then start prenatal vitamins, in particular folic acid and iodine. All right, so what about men? Because I haven't really spoken about men at all. Most, if not all, medications are safe and do not harm the fetus. And that sort of information has changed in the last 5 years. And so, there are a couple of medications that have the possibility of temporarily reducing sperm counts, but that is not something to be worried about unless there is an issue with falling pregnant. And once again, the same issues, stop smoking, maintain healthy weight, don't use recreational drugs. So moving on, that was before pregnancy. The main key take home is plan, okay? Plan at least 6 months before you try to fall pregnant. But, during pregnancy. So how many times should I see my rheumatologist? What should I be doing during pregnancy? it really depends on your condition. If things are stable, well, then once every trimester is more than enough. But that is really pending the personal situation. Now, having routine pregnancy monitoring is important. So all of the usual things that you would do with a GP, which includes things like measuring blood pressure, weight, screening, morphology scans, glucose tolerance tests, and additional tests if they're needed. But that's something that your GP or obstetrician will guide you through. Okay. And then the other questions that you might have are, what will happen to my condition in pregnancy? Will my arthritis flare if I stop taking my medication? So these are really important questions to be asking your rheumatologist, in the planning phase as well. So this is sort of based on data, but you don't need to worry too much. Overall, mostly conditions are stable or can improve, particularly in things in rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis. Most conditions are stable, especially if you went into pregnancy with controlled activity of your condition. There are some increased risks in active disease and particularly active lupus, right? But if your condition is stable prior to pregnancy, well, then those risks are reduced. And once again, remember that most pregnancies are safe and uneventful, and one of the happy times of your life. So, how can we tell the difference between what is the result of pregnancy or a flare of the condition? Now, that can be really difficult because there are a lot of pregnancy-related changes, and it can be difficult to tease out from a flare of your condition. So, firstly, pregnancy increases fluid retention. So, you're almost 50% more than your baseline by 34 weeks. You can get widespread joint pain from being pregnant alone. As the abdomen increases, it can cause sort of tension around the ligaments, and the growing uterus can tug on that, so you can get more abdominal pain, back and pelvic pain. And through pregnancy, there's a change in the hormones, so the muscles and ligaments become more relaxed. So you can be prone to like rolling your ankle and injuries such as that. Constipation, given the fetus is taking up so much room in your abdomen. And so all of these things can be really difficult to tease out from what's related to the condition and what's related to pregnancy. Okay, and so emotional health is really important too, because it doesn't always look like the magazine and TVs. There's a lot of ups and downs. It can cause a lot of stress. You can be really tired. Something that's not talked about often is that miscarriages can be common. The general rate of miscarriage in the population is 1 in 10 pregnancies will be a miscarriage. So it doesn't necessarily have to be because of your condition that's why, but that can be really hard, and it's not spoken about very much. So it's really important to make some time for yourself, arrange for help and accept it. For people that have existing mood disorders, it's important to have those supports in place, regular psychologists, a psychiatrist if needed, and the support people in place, because it can be an absolute roller coaster. So making sure that you look after yourself, because a pregnancy definitely can affect your mood. Okay, so that's during pregnancy, and that was a lot of information, but it's a continuous discussion that you have with your care providers. So after pregnancy, it's really important that once pregnancy has come through, that you look after yourself, because you can focus very much on bub and not go to appointments. It's really important to make time to go to an appointment to see your rheumatologist about 4 to 6 weeks postpartum, because most conditions that can be quiet in pregnancy can become active after you've delivered. So you should absolutely have a checkup, okay? Will you be able to breastfeed? Mostly yes, but it's not easy, and so don't be worried or upset if it doesn't happen straight away. There are some conditions around medications for your baby, and the advice that has been widely said is don't give the neonate your baby a live vaccine, which is only the one oral one. But that's sort of changing and probably will continue to change. And another big one is, or question that I get asked is, will my kid have this? And, it is not a one-to-one condition. It's not, most of our conditions are not hereditary like that. So do not worry so much about that type of line of thinking. And always ask and accept help when it's given, because definitely need help. Now, contraception, you want to make sure that after you, or even in planning for pregnancy, if you're not ready, if your condition's not stable, that you consider contraception, because we know that contraception is underused in most of our patients. And so we need to think about the condition and whether there's any particular contraceptions that are better, and medication-related factors. And so that's something you should talk to your GP, but also your rheumatologist about which contraception might be safest to plan for pregnancy effectively. So in a conclusion, I, rushed through that. Listen to your body, take care of yourself, attend appointments, particularly postpartum, even though it seems like you have no time. Ask for and accept help. And then here are some useful contacts. So MotherSafe is a clinic and unit run out of the Prince of Wales Hospital, or the Royal Hospital for Women, actually. And you as a patient can call and ask about your medications if you want some further reassurance or some guidance around what to do about medications in pregnancy. It doesn't have to be just rheumatology medications. It can be other medications as well. The Australian Rheumatology Association has some information for patients around pregnancy, as does Arthritis Australia. My RA has some information around rheumatoid arthritis in pregnancy. There's a smoking quit line, because you should absolutely quit smoking prior to pregnancy. Alcohol and drug information services, and some help for your psychological support if needed in the Trillium Parents Helpline or the Karatani Care Line.
So you've just finished watching part 1 of one of our recent educational events. Hope you enjoyed the content. If you'd like to access part 2, then you need to sign up for BJC Connect. It's a free platform where you can access not just the recordings of past events, but also access a whole range of upcoming future events and access our team of facilitators live. All of the details that you need to join BJC Connect are now flashing up on your screen. Otherwise, like our staff, subscribe if you'd like to see more information from BJC Health. Look forward to seeing you in